Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about Baclofen. What is Baclofen? Baclofen is a skeletal muscle relaxant and antispastic agent primarily used to reduce muscle stiffness caused by condition affecting the brain or spinal cord. It helps improve muscle movement, relieve pain, and make daily activities easier. Drug class: centrally acting muscle relaxant, type GABA-B receptor agonist. How Baclofen works? Baclofen works by activating GABA-B receptors in the spinal cord and brain. GABA is the body's main inhibitory neurotransmitter. When Baclofen stimulates GABA-B receptor, it reduces the release of excitatory neurotransmitters, decrease nerve signals that cause muscle contraction, inhibits spinal reflexes responsible for muscle spasticity, relaxes skeletal muscles without directly acting on the muscles themselves. Result: reduce muscle spasm, stiffness and pain. Uses of Baclofen. Baclofen is commonly prescribed for multiple sclerosis, reduces muscle stiffness, improves mobility, relieves painful muscle spasm. Spinal cord injury: creates severe muscle spasticity, improves movement and comfort. Cerebral palsy: helps reduce abnormal muscle tightness. Stroke: may improve muscle rigidity and spasm. Other neurological disorders: brain injury, spinal cord diseases, certain inherited neurological condition. Off-label uses: some doctors prescribe Baclofen for persistent hiccups, alcohol use disorder, trigeminal neuralgia, muscle spasm from the neurological condition. Common adult dosage: typical oral dosage, initial dose 5 mg 3 times daily, increased gradually every 3 days if needed. Usual maintenance dose 40 to 80 mg per day. Maximum recommended oral dose 80 mg per day. Although higher doses may occasionally be used under specialist supervision, important: Baclofen should always be started at a low dose and increased gradually to reduce side effects. Common side effects: most common: drowsiness, dizziness, weakness, fatigue, sleepiness, nausea, headache, dry mouth. Less common: blurred vision, confusion, constipation, low blood pressure. Serious side effects: seek medical attention immediately if you experience difficulty breathing, hallucinations, severe confusion, seizures, severe muscle weakness, loss of consciousness, allergic reaction. Baclofen withdrawal: do not stop Baclofen suddenly. Abrupt discontinuation can cause severe muscle spasm, high fever, hallucinations, anxiety, agitation, seizures, confusion, organ failure. Rare but serious. The dose should be reduced gradually under medical supervision. Overdose. Symptoms may include extreme drowsiness, slowed breathing, severe muscle weakness, low blood pressure, slow heart rate, loss of consciousness, coma, seizure. Overdose is a medical emergency and required immediate treatment. Pregnancy. Baclofen crosses the placenta. Human data are limited and it should generally be used only if the potential benefit outweighs the potential risk to the fetus. Sudden discontinuation during pregnancy should be avoided if the mother depends on the medication. Always discuss the risk and benefits with the healthcare provider before using Baclofen during pregnancy. Breastfeeding. Baclofen passes into breast milk in small amounts. Oral Baclofen is generally considered compatible with breastfeeding, although infants should be monitored for excessive sleepiness, poor feeding, weakness, high doses or intrathecal therapy may require closer monitoring. Consult a healthcare provider before using Baclofen while breastfeeding. Drug interactions. Baclofen may interact with opioid pain medications, increase risk of sedation and respiratory depression. Benzodiazepine like diazepam, lorazepam. Alcohol increase drowsiness and dizziness. Sleeping pills, other muscle relaxants, antihypertensive medication may increase the risk of low blood pressure. Contraindication and precautions. Use Baclofen cautiously in patients with kidney disease, epilepsy or seizure disorders, psychiatric illness, Parkinson's disease, elderly patients. Key counseling points: take exactly as prescribed. Do not stop the medication suddenly. Avoid alcohol while taking Baclofen. Be cautious when driving or operating machines until you know how it affects you. Rise slowly from sitting or lying position to reduce dizziness. Inform your healthcare provider about all medication and supplements you are taking.